Today's presentation will focus on cardiology patient intake, improving workflow for faster access, better organization, and increased satisfaction. Hi, my name is Michelle Donowsky, and I'm the Executive Director of Clinical Optimization at eHealth Technologies. We all know the stats on cardiology patients. Nearly half of Americans have some form of cardiovascular disease. Heart disease is the #1 killer in America, and the number of patients needing cardio specialists is increasing. In fact, by 2030, it's projected that the medical costs for coronary heart disease patients will increase by 100%. The question is your organization doing everything it can to improve patient outcomes and experiences? It starts with medical records. Streamlining medical record retrieval. What can cardiology departments do to streamline care for newly referred patients? Cardiology patient intake has its own set of challenges. You need more than just reports. Cardiology teams need full original imaging, including echocardiograms or cardiac caths. Patients have often been to multiple providers and to multiple test facilities. So there are a lot of providers that need to be reached out to, oftentimes out of network. Each of those providers has their own process. There are many different processes that need to be taken into consideration when reaching out to gather those images and records. Time. The diagnostic test results, image CDs, and faxes take time to retrieve, to scan, and to organize. With eHealth Technologies, your cardiology department has access to the critical patient information you need so that you can create a treatment plan prior to that first visit, and you can avoid duplicate testing. We help our partners focus on patient care instead of paperwork. eHealth knows cardiology. You may have colleagues with some of our partners, Northwestern, Johns Hopkins, Cleveland Clinic, to name a few. We also partner with UC San Diego. Recently, we partnered on a case study. Their situation was that they had double-digit growth, which was putting a strain on their staff. Many of their patients had long histories of heart disease with records at multiple different care locations. So what happened after implementation of eHealth? Well, we gathered the patient records, organized them into a consistent searchable format, and then delivered all of the records directly into the EMR and all of the images we retrieved directly into their packs. The staff and patients were no longer burdened with gathering records prior to the initial visit, and the record reviews are completed a lot sooner because all records and images are available prior to that first visit. The patient and the staff satisfaction rates are at an all-time high. UCSD staff are now able to focus on bringing in new patients, scheduling follow-ups, and spending time answering patient questions. Cardiology reports. It is critical that cardiology teams have the complete access to the right information. Faxes of reports, such as tracings, can often be hard to read. The eHealth solution ensures reports are fully legible by your clinical team. If reports are not legible, we reach back out to the provider and perhaps even go to the provider of source to get the legible information that's important to your assessment. This will help eliminate repeat tests. Medical imaging. We found that without eHealth, it takes at least 2 weeks or more for facilities to retrieve records and images. There's significant staff time being spent on tracking down and uploading records. With eHealth implementation, records are received within 3 to 5 days, and there's a tremendous reduction in staff time needed to manage the records, the release forms, and retrieval and upload. Using eHealth's integration services, images can be sent directly to PACS, even separate systems within an organization. If your normal imaging need to go to traditional PACS, and you may have a cardiology PACS that we need to send cardiology images to, that is something that we can accommodate. There's no CDs coming into your facility. All QA takes place at eHealth, and there's no manual loading for your staff. Customized integrations are available, and it does not interfere or interrupt with the existing flow of DICOM images being uploaded from other departments. Record output in 3 formats. eHealth has streamlined record formatting, and it can simplify how records get into the right hands. We can create an index composite document, and that is with records being all records received from all providers are organized into one PDF with hyperlinks and keyword bookmarks. We can break those out into separate PDFs based on category. So each category, MD notes, labs, cardiology procedures, can be in their own PDF labeled as such. Or we can break each record out individually and name it by date of service, the category that record would fall into, and then exactly what that record represents. An example of that would be a medical record from 12/1/20 that was in the radiology section. That was a CT chest with contrast. That's the level of detail that we can achieve with individual PDF documents that can then be pushed directly into your EMR. With our intelligent clinical record services, within the single index document, you can apply keywords that are important to your practice and your patients. Those words will be highlighted throughout the document, and on the left-hand side of the bookmarking pane, you'll see all of those words, the dates of service, and the category within which record those words will fall. So you can easily navigate through that document in multiple ways. What to expect with eHealth technologies. With eHealth, you have streamlined patient workflows with fast access to patient records and images within the EMR and PACS. Faster review with clinically organized records in a searchable document. Improve patient experiences and increase staff and physician satisfaction. If you want to learn more, you can call 877-344-8999 or visit us at ehealthtechnologies.com. Thank you so much for your time and attention today.